We now have something that we call the heart attack blood test. This is called a troponin. It's a blood test that checks for heart attacks. It checks for an acute MI. If you go into the hospital saying, ouch, I have chest pain, they check this thing called a troponin, which is a blood test. Of course, they do an EKG too to see if you're having an ST elevation MI, where your EKG part of it, called the ST segment, goes up. That's called an ST segment of MI. That means the entire opening of your artery is completely blocked 100%. We take you straight to the cath lab to do that. But if you're having chest pain and the artery is open, maybe just a little bit of it is blocked or it's starting to plug up, you'll have something called a troponin leak, where your troponin blood test goes way up. That means you're having a slightly different kind of heart attack. You do have to go to the cath lab to get that opened up, but it can usually wait up to 72 hours if needed. It's not an emergency. It can wait till the next morning or the next day if we're trying to work on something else as well. That is called the troponin. It is a blood test for heart attack.